Welcome to Hardly, where books turn into 3 stories, refreshing your knowledge in minutes. Today, we study together Gary Taubes' book, Rethinking Diabetes, what science reveals about diet, insulin, and successful treatments, in which we probe into how dietary misconceptions and evolving science shape our understanding and treatment of diabetes. Gary Taubes is a 3-time recipient of the Social Science Award from the National Association of Science Writers and the Robert Wood Johnson Foundation Health Policy Research Fellow Award. Don't go away. Hurdley, the editor, will be right back with the story. Today, we dive into 3 compelling stories that shed light on how misconceptions about diet have shaped and sometimes misled the treatment of diabetes. These stories explore a controversial debate between 2 scientists on the role of carbohydrates, a radical experiment in treating patients with a high-fat diet, and a medical breakthrough that turned the world of diabetes treatment on its head. Let's begin. 1. The Great Carbohydrate Debate. Our first story takes us back to the mid-20th century when the medical community was fiercely divided over the role of carbohydrates in managing diabetes. On one side, Dr. George Cahill, a leading researcher, argued that a low-carbohydrate diet was essential for diabetes management. His research showed that reducing carbohydrate intake could stabilize blood sugar levels and reduce the need for insulin. On the other side of the debate was Dr. Nathaniel Frerichs, who believed that carbohydrates were necessary for a balanced diet and that diabetics could manage their condition with medication and careful monitoring. The debate reached a boiling point at a medical conference in 1969, where both scientists presented their findings. Cahill recounted an experiment where patients with type 1 diabetes were put on a high-fat, low-carb diet. Within weeks, he noted, their blood sugar levels stabilized dramatically, and their reliance on insulin decreased by half. Frerichs countered with data showing that a balanced diet, including carbohydrates, could be managed effectively with modern medications. The room was divided, with doctors and researchers passionately debating the implications. Cahill's supporters argued that his approach offered a natural way to manage diabetes without the constant use of drugs. Frerichs' camp warned that a high-fat diet could lead to other health problems, such as heart disease. As the conference drew to a close, no consensus was reached, but the debate laid the foundation for future research on the effects of diet on diabetes. This heated discussion set the stage for the next story, where a bold doctor took Cahill's hypothesis to the extreme, attempting an experiment that would challenge everything the medical community thought it knew about diabetes management. 2. The Radical Experiment. In the early 1970s, Dr. James Anderson, a maverick in the field of endocrinology, decided to conduct an experiment that many of his peers thought was reckless. Inspired by Cahill's findings, Anderson wanted to see if a strict, high-fat, low-carbohydrate diet could completely replace the need for insulin in some patients. He recruited a group of 20 type 2 diabetes patients, all of whom were on high doses of insulin. His plan was to gradually wean them off insulin while transitioning them to a high-fat diet, rich in meats, cheeses, and oils, with minimal carbohydrates. The results were shocking. Over a 6-month period, all but 2 patients were able to stop using insulin entirely. One patient, a middle-aged woman who had been on insulin for over a decade, was particularly remarkable. After just 3 months on the diet, she was not only insulin-free, but had lost 30 pounds and reported feeling more energetic than she had in years. Dr. Anderson was ecstatic. "This could revolutionize the way we treat diabetes," he proclaimed to his colleagues. However, the experiment was not without its critics. Many in the medical community were alarmed by the potential risks of a high-fat diet, especially for heart health. Some of Anderson's patients began experiencing elevated cholesterol levels, leading to concerns about long-term cardiovascular risks. The medical community was again divided, with some hailing Anderson as a visionary and others calling him reckless. Despite the controversy, Anderson's experiment sparked a wave of new research into alternative dietary approaches for diabetes. It also set the stage for the next significant breakthrough in diabetes management, one that would forever change the landscape of the disease's treatment. 3. The Insulin Discovery Redux. The third story takes us to the 1980s, a time when the medical world was still grappling with the limitations of insulin therapy. Although insulin had been a lifesaver for many, it was clear that it was not a cure. Many patients experienced severe complications over time, such as nerve damage, blindness, and heart disease, even when following prescribed treatment regimens. Researchers were desperate to find a better solution. Enter Dr. Richard Bernstein, an engineer turned doctor who had been diagnosed with type 1 diabetes as a teenager. Frustrated with the lack of progress in diabetes treatment, Bernstein decided to take matters into his own hands. He began meticulously monitoring his blood sugar levels throughout the day, adjusting his diet and insulin doses based on his findings. Through rigorous experimentation, he discovered that a low-carbohydrate, high-protein diet allowed him to maintain stable blood sugar levels with minimal insulin use. Bernstein's approach was revolutionary. He published his findings in a medical journal, sparking both intrigue and skepticism. One passage from the book captures this moment. Against all odds, Bernstein demonstrated that with careful monitoring and a strict diet, it was possible to achieve near-normal blood sugar levels and prevent the devastating complications of diabetes. His work challenged the prevailing belief that diabetes management required high doses of insulin and a moderate carbohydrate intake. While Bernstein faced significant pushback from the medical establishment, his methods gained a following among patients who were tired of the traditional approach. His findings eventually led to a new wave of research exploring the benefits of low-carb diets for diabetes, echoing the earlier debates, but now grounded in more solid evidence. His persistence also paved the way for a more individualized approach to diabetes care, recognizing that what works for one patient might not work for another. As we can see, these stories are not just isolated events, but part of an ongoing narrative about how our understanding of diabetes and its management has evolved and continues to evolve over time. Conclusion. These 3 stories illustrate the complexities and challenges in understanding and managing diabetes through diet. They show us that what we once thought was a simple disease managed by straightforward rules is, in fact, a complex condition that requires a nuanced approach. Over time, the medical community has learned that dietary misconceptions can lead to both breakthroughs and setbacks in treatment. it is clear that more research is needed to fully understand the best dietary practices for diabetes management. As the editor of Hardly, by learning from these stories, we can push forward the boundaries of medical research, challenge existing paradigms, and seek more effective, individualized treatments that prioritize the patient's overall well-being and quality of life. Reflecting on the key argument that dietary misconceptions have significantly influenced diabetes treatment, it's clear that evolving science continually reshapes our understanding of the disease. We've seen through various stories how debates, radical experiments, and medical breakthroughs have challenged old beliefs and introduced new perspectives. One particularly striking story from the book involves a physician named Dr. Rosalind Unger, who, in the 1990s, decided to challenge the prevailing low-fat dietary recommendations for her diabetic patients. Frustrated with the lack of progress in her patients' health using conventional diets, she introduced a high-protein, moderate-fat regimen. To her surprise, many patients showed improved blood sugar control, lost weight, and reported higher energy levels. One patient, an elderly man who had struggled with severe diabetic complications for years, saw a remarkable turnaround in his health. After 3 months, Unger observed, he no longer required insulin, and his cholesterol levels had improved. Her bold approach opened new discussions on the role of dietary fat and protein in managing diabetes. Through these stories, we reaffirm that challenging existing dietary guidelines and misconceptions can lead to innovative treatments that improve patient outcomes. As new research emerges, it is essential to stay open-minded and adapt our approaches to provide the best possible care for those living with diabetes. As the editor of Hardly, by embracing a spirit of curiosity and a willingness to question long-held beliefs, we can better equip ourselves for the future of medical science and patient care.